Today I would like to talk about biomedical relevance of nonlinear dynamics or chaos theory. You probably heard about chaos theory, which is a popular name of nonlinear complex systems dynamics. I'm Milena Trukic, Master of Biomedical Engineering and PhD in Neuroscience. If you think about the first strategy that medical professional working in clinical science, whatever, psychiatry for example, when one wants to check the hypothesis, the most probable way would be to compare the means of recordings of the group of patients and healthy controls. And conventional approach is to calculate the means and standard deviation to see whether they are different in order to confirm or reject the hypothesis of the research. But very often that approach does not give valuable information. I will give you one example. I will mention an example from cardiology because cardiology is the first branch of medicine that allows nonlinear dynamics to enter. So you have a healthy person and record electrocardiogram, electrical signal of the heart of that person, and you record the same signal, electrocardiogram, from a person who had congestive heart failure. If you calculate the means and standard deviation, they're not so different. In other words, you would hardly see that they variate too much from the same mean. But if you even look with naked eye those signals, you will see that this is quite different dynamics. So how do we quantify that? If we apply fractal and nonlinear analysis to compare those signals, then we can have meaningful results because nonlinear measures are capable of detecting very subtle differences in disease and health, even when that disease didn't reach the clinical threshold, meaning that that kind of analysis can be useful even in detecting that something is coming. For example, a heart failure, a movement disorder, or something like that. So I would like to talk about this difference. This idea that some other approach to analyzing physiological signals can be fruitful is not so new. The first observation is known from 1916, when Dr. Chain actually noticed that his congestive heart failure patient has a very predictable pattern of breathing. And if you check medical books, you can see that as the Chain-Stokes syndrome. Another attempt was from 1948, when Dr. Riemann actually had a claim that every disorder has a kind of predictability, meaning that you can see some cyclic behavior, some repetition, some recurrence in symptoms, and it can be applied for quite different classes of disorders, like Parkinsonism, movement disorders in general, then for a series of heart disease, different kind of pathologies, even in certain kinds of leukemia, and even in mood disorders. For example, depression can have that kind of cycles. So if we turn back to the classical basis of physiology, there is a notion that every physiological control system actually works to keep the system in sort of standard state without fluctuating too much from it. But in reality, if you check any physiological signal, you can see that our physiological signals are not predictable. On the contrary, if you have a healthy dynamics, your system is non-stationary, nonlinear, noisy, and unpredictable. And this is a very different dynamics from what would be advisable to apply if you are in clinical setting and if you're running the research. So how we should solve this problem? First of all, when you record any electrophysiological signal, bearing it electrical signal from your brain, electroencephalogram, electrical signal from your heart, electrocardiogram, or electrical signal from your muscles, electromyogram, you have some signal in time. You sample those values, which are values of voltage, and therefore you have time series. So all those signals are generating time series, which are important to analyze because they have specific structure, which can give you a lot of data if you know how to analyze them. So first of all, I want to make the difference between linear and nonlinear system. What means linear? For example, Ohm's law, when you have from one side voltage and you want to calculate current or vice versa, the proportionality exists in R, which is resistance, and the output of the system is linearly dependent of input. So there is nothing surprising in that problem. If you know proportionality, and if you know one value, you can calculate the next. So the strong characteristic of any linear system, which is predictable, is linearity and superposition. But that doesn't apply to nonlinear systems, and every signal recording from human physiology is actually violating those rules for linear system. Every signal is nonlinear, non-stationary, and noisy, and it's very hard to predict. Why it is so? Because we are not constant, we are chain. We have to live, the change is actually the only constant of our lives, because you have to adapt to all the new conditions from your environment, be it external or internal, because your internal systems are also changing. What does that mean in practice? For example, if you want to run up the stairs, your heart has to adopt completely different dynamics in comparison with your sitting and doing nothing physically. If you have any kind of challenge, all your systems, including your heart, which is one of the vital organs, has to be able to adopt completely different dynamics. In order to be able to adapt, that signal has to have really big range of variability around the mean. It is not just standard deviation. This is something that we call organized variability, and people used to think about that variability to be simply the noise in electrophysiology, but it turned out to be very valuable information that we can use for nonlinear analysis. To summarize, if you approach analysis of electrophysiological data coming from human body, and if you realize that reductionistic approach, like any method based on Fourier's analysis, which works well in mechanistic and in linear systems which are predictable, is actually leading to misinterpretations in electrophysiology. And it is imprinted in every apparatus working in every hospital, meaning that we really need to shift to fractal and nonlinear analysis of electrophysiological data in order to really understand what is going on. Because what doctors know so well for centuries now is that stereotypy of disease is their guide. For example, if you have patients of one disease, let's say Parkinsonism, most of the patients share the same symptoms. And this is something which gives the doctor a possibility to classify them against normal controls, which are healthy. So nonlinear dynamics is a very appropriate way to quantify that difference. Professor Goldberger, who generalized what Dr. Riemann and Dr. Chains were talking about in 2 centuries ago, in last 2 centuries, sorry, actually explained how that stereotype of disease can be quantified in order to really be sure about certain disorders and even to early diagnose disorders which are coming. So if you are interested in this kind of topic, I advise you to learn more about fractal and nonlinear analysis in electrophysiology. Thank you.